So for anatomy and physiology, they have all the body systems. They have circulatory system, muscular system, digestive system. They have the endocrine system, integumentary system, all of that, right? And I was looking over these things because I have to differentiate between what is on and what is not on the exam, right? And thank goodness that they have this area where they specify areas that are outside the scope of testing include the finest details, such as, right? Thank goodness that they have that on there, because I figured out that there are some things that we've been studying which are not going to be on there, and I guess it would be faster if I didn't find that on the page now. But basically, it mentioned specifically that the gates are not going to be on there, and also the sequence of events, the 7 sequences of events of neuromuscular firing, or of an action generation of an action potential, are not going to be on there. So that is, I guess on the one hand, for me, kind of it's a relief, because now you guys, I don't have to drill you guys on that, and you don't have to go in being responsible for that. However, it's what's the word? It's not a good feeling that have been spending time coaching you guys on that. So yeah. So some aspects of muscle contraction, advanced aspects of muscle contraction, like latent period, we weren't going to cover that anyway, but identify the sequence of events involved in the process of action potential production or impulse transmission across a synapse. So that's not going to be on the exam. And look, like, at least we can. But there's other stuff I was surprised is going to be on there, like the cascade of chemical reaction. It's not going to be on there. You're going to have to know some basic functioning of different categories of blood items, like red blood cells, platelets, what do platelets do, that was kind of surprising for me. So let me just see quickly if there's anything else that's, no. Okay, so we're going to do the cardio, or the circulatory system tonight, and of course we're going to start with reviewing our basics. And all righty, so let me switch, and we're going to go over movements and range of motion, and then planes. Oh, where's my? Uh-oh. Looks like I may have lost connection. Can you guys hear me?
Yes.
Can you guys hear me? Okay. It looks like I froze.
Yeah, I
Can
can
you guys hear me?
Yeah.
You
You did
can
freeze,
hear
but
me.
we can hear you.
Okay. But you can't see me, can you?
No, we can see you.
Well, we can see you, but not moving.
Not moving. Yeah, well, okay. All right, so I'm not moving. Do I have a pulse? All right, let's see here. So do you see my feet now?
No. Oh, the feet.
Okay. See them now?
Yes.
Yes. And you're moving.
Yes. Okay. Okay, great. So let's take a look at the movements of the lower limb. All right, so we're going to start with the feet and the ankles and the knee, and just get those out of the way. Sorry, it's a little difficult for me to get the angle just right in this new setting here tonight. Every night's a little bit different over here in my household. Yeah, this would be good. Can you guys see well enough? Is this satisfactory for you?
Yes.
Yeah, I know it's a little chaotic in here. I apologize. All right. So I'm going to quiz you guys a little bit more tonight rather than walking you through. I really want to move on from the stuff that we've been practicing to make room for other stuff. What's the top of the foot called? The back of the foot? Everybody unmute and call out, even if you have no idea. What's the back of the foot called? The dorsum, S-A-M, the dorsum of the foot. Yeah. But if you said dorsal, if you thought dorsal, that would be perfect for the exam. That would be more than enough for you to pick that out of a multiple choice question. The dorsum of the foot, and then the bottom of the foot is called what?
Plantar.
The plantar surface. Yeah. Plantar and dorsum. Plantar and dorsal. Yeah, that's fine. So if I lift my toes up this way, toes up, heels down, what kind of movement is that called?
Flexion.
Flexion.
Yeah, flexion, but these are both flexion. These are both flexion. So which way is this flexion?
Dorsiflexion.
Dorsiflexion. And what kind of flexion is this? Somebody other than Samantha, other than Stephanie?
Plantar flexion.
Plantar flexion, yes. And what about the movement of the ankle? What kind of movement am I? What plane am I moving moving my ankle in? So let me help you guys out. If you look at the body from the front, right, we always start from anatomically neutral. So that's palms facing forward, toes facing forward, right? So my midline is right here. All right. So what plane is this movement in?
Sagittal.
This is sagittal plane. Exactly. Sagittal plane. And then what kind of joint do you think this is? Is this a ball and socket joint, a pivot joint, a hinge joint, condyloid joint?
A plane
Ball and
joint?
socket.
There's only two ball and socket joints. That's the hip and the shoulder.
Is that a
But
plane?
I heard, yes, it is. It is a plane joint because it does have some movement through different planes. However, it's also regarded in some texts as a hinge joint. So just be ready that they should be distinguishing. If they ask you what type of joint is the ankle, they should be distinguishing through the multiple choice. In other words, I don't think that they're going to put hinge and plane, both of those options in the same answer battery. Okay, so which what kind of joint is the knee?
Hinge.
Hinge joint. Very good. Does anybody remember, maybe we didn't cover this yet, does anybody remember the name of the type of joint between the fibula and the tibia? What kind of joint is this?
Oh,
It's joined by connective tissue, and it allows for some movement and some stability.
Is that
It's a sin what? Syndesmotic joint. We'll go over that again. Okay, so inversion and eversion. When we invert the ankle, or evert the ankle, there's three joint movements that are happening there, right? Your options are abduction, adduction, plantar flexion, dorsiflexion, supination, and pronation. So tell me, which movement am I making with the ankle when I go like this? Is it supination or pronation?
Supination, I believe.
Supination, that's right. And so this one must be pronation. Do we all agree on that?
yes.
Yes.
Great. Vincent, how would you describe this movement if somebody had never seen pronation before? How would you say that the foot or the ankle is moving when to describe it to someone accurately?
The foot is moving out from the body, so it's pronation.
Okay, out from the body like this?
No, it's from the side. I don't even know how to explain it.
From the side like this?
Yes, more like that.
More like this, you mean? So I would say that the pinky toe is picking up, or the lateral edge is picking up, And the great toe, big toe, or medial edge is pointing down. Can you see that?
Eversion.
Yeah, that's eversion. Yeah, but if someone had never seen eversion or never seen pronation, then hopefully you would know that to use something like what I used, where you talk about the lateral edge and the medial edge going in different directions, for example. Okay, so when you supinate this way, there's also something happening in the flexion. Is it dorsiflexion or plantar flexion happening?
Dorsal.
Dorsiflexion would look like this.
Yeah, it's plantar flexion.
Foot is going this way. It's plantar flexion. That's right. So now we have supination, and plantar flexion. And then something is happening in relation to the midline. That's abduction or abduction or adduction. So we have some supination. We have plantar flexion. And now what do we have here?
Adduction.
Abduction. Adduction. Yeah.
Yeah.
Right. So one more time, we have adduction, and then we have plantar flexion, and then we have supination. And altogether, those three movements comprise what movement of the ankle? Inversion or eversion?
Inversion.
Inversion, yeah, in toward the midline, and E is just, away. Okay, so now eversion, I'm going to switch because my hamstrings are getting tired over here on the other side. So is this picture clear? Looks like it's in focus. Please let me know if it's not. Okay, so we just did inversion, which has plantar flexion, it has adduction, and it has supination. And we established that with eversion, we have some aspects of pronation. What's happening in relation to the midline when we evert?
Going away from the midline.
That's right. And that going away from the midline, and that's called what?
Go take out the bathroom trash and put the sweeper forward.
Is that abduction or adduction?
Adduction.
Abduction.
Yeah, AB. Remember, Vincent, they don't let you change your answers on the test. Sucks. But you gotta like have. Do they give you guys scratch paper or something?
I got some.
Well, on the test, are you going to be allowed to write down your answers? To troubleshoot and double check things on paper, for example? That might be a good strategy.
I don't remember.
They just gave me
okay.
a whiteboard or eraser board.
Okay, well, at least you have that. So you could, for example, write down AB and AD and then look at it and think about it. Okay, so you have pronation and abduction, and then which is this way, abduction, and then you also have some aspect of flexion. So is there dorsiflexion or plantar flexion happening here?
Dorsal.
Dorsiflexion, that's right. It's actually dorsiflexion, letter I, dorsiflexion. Yes. Okay. So what else do we want to know? What's the name of the muscle here in front of the shin? Is this the gastrocnemius, the soleus muscle, or the tibialis anterior?
Tibialis anterior.
And what's the primary movement the tibialis anterior does? Does it do eversion, inversion, or dorsiflexion?
Dorsal.
Dorsiflexion, that's right, dorsiflexion. What are the two prime movers in the back of the leg, in the calf muscles?
The
gastrocnemius, which is on the outside, right? It's the one you can feel, and then below that, underneath that, what's the name of that one? It's longer and wider and actually more powerful than the gastrocnemius. What's the name of that one?
The preanis latius brevis. That's what you name.
Nah, the soleus. 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 Yeah. Okay. The name of the thigh muscles. It's also called the what triceps group. The what? The triceps group, the quadriceps, or the quinticeps group?
Quadriceps.
Quadriceps. And why is it called quadricep? Because there's
4.
4 muscles. Name the 4 muscles.
The quads. The
Yeah. So there's a medialis, there's an intermedius, there's a lateralis, there's a rectus. What's the name of this bone here? Yes, very good. What's the name of this bone?
femur. I mean,
Femur. So so rectus femoris.
mhm.
Yes, rectus femoris or rectus femoris, both the same. Vastus what?
Vastus.
The laterals.
Vastus lateralis. That's right. Vastus lateralis. Am I still sharing my screen?
Yes.
Mhm.
Yeah, I want you guys to have a bigger view like that. I'm sorry. So vastus lateralis, and then on the inside is vastus what?
Medial.
Vastus medialis, vastus medialis, and then under the rectus femoris, deeper inside is what muscle?
Infra.
No, not the infra, but inter. So lateralis, medialis, intermedius.
Okay.
Lateralis, medialis, intermedius. Okay, one more time. Rectus what?
Femoral.
Yeah, and what's
Femoralis.
deep to, right? And what's deep to the rectus femoris? The vastus what?
Vastus lateralis. No.
Vastus lateralis is on the side, on the outside of the rectus femoris. Here's the rectus femoris. Here's the vastus lateralis. What's under the rectus femoris? The vastus vesturalis, lateral, medial, and what? Yes.
Intermedius.
Keep it
You
coming.
just said it. I forget.
Intermedius.
Medial.
Yes.
Okay.
Intermedius. Lateralis, medialis, intermedius.
Okay.
Everybody. Lateralis,
Lateralis.
medialis,
Medialis.
intermedius,
Intermedius.
rectus femoris,
Rectus femoris.
Rectus femoris.
quadriceps group. Very good. Okay, what else do we need to do while I'm down here? What's the name of this joint movement for the hip right now? What am I doing with my hip? From neutral into what?
Flexion.
Yeah.
That's right, flexion. And then which way am I moving the hip this way when I go like this?
Extension.
Extension, that's right. When I move into flexion, which muscles are the prime movers? Are they on the front surface or the back surface?
The
Back.
front.
The front surface, yes. Which muscles are in the front that are responsible for hip flexion?
Hip flexors.
Hip flexors, yes, but that's like a broad term, like quadriceps. Which specific muscles make up the hip flexors?
The
It-
tender
one-
follis latus. Latae. Tenders follis lata. Latus. Lata. Hello?
Did we lose him?
I can't hear him.
Sorry, I'm back. My microphone cycles sometimes because it's got because it's Bluetooth, so it's got a battery on board, and sometimes it switches off and switches back on. It takes just a second. So you're naming the tensor fascia lata, which is on the side, but the hip flexor proper starts inside next to the spine. Two muscles like this. Psoas muscle, excellent. And then the psoas fibers come down and they join with muscles that are inside the iliacus. What's that muscle? Or inside the ilium? What's the name of that muscle?
The iliac crest.
Iliacus muscle. Iliacus muscle. So it's the psoas joining with the iliacus, and then they form this third muscle down here called the what?
Is that that ASIS?
ASIS is the bone right here. We'll look at a
Okay.
picture of it. Hold on a second. Maxwell,
What's after 29?
eat at the table, not in your room. This is the ASIS is the anterior superior iliac spine. Okay. So you have the psoas muscle, you have the iliacus muscle inside the ilium, and the psoas and the iliacus, they join to insert or to attach to the femur, and that's called the iliopsoas. So everybody, psoas, iliacus, iliopsoas.
Iliosoas.
Yeah, again, psoas, iliacus, iliacus, iliopsoas. One more time, a little bit slower. Psoas, iliacus,
Iliacus,
iliopsoas.
ilioso. That's it.
Great. Okay. We established that this plane is what? For flexion, for like hip flexion, shoulder flexion. This is what?
Digital?
What's that?
Is that sagittal plane?
Sagittal plane. That's exactly right. Sagittal plane. Now, also, I would like to know what movement am I doing with my arm right now?
Abduction.
That's right. That's right. Abduction and then adduction. And what plane is this?
Coronal.
That's right. Coronal. If I keep moving my arms through abduction, I eventually touch the corona. That's right. And what plane is this for the shoulder?
Front. No.
Frontal is also coronal. So this is
Okay.
also,
Dorsal.
Horizontal.
no, dorsal is a surface, dorsal and ventral.
Oh.
Is that parasagittal?
Horizontal.
No, well, you could say parasagittal, yeah, parasagittal, but sagittal would be just fine,
Oh, okay.
right? So hip flexion is sagittal, knee extension and flexion are sagittal, the dorsiflexion and plantar flexion of the foot are sagittal, and then the flexion of the arm is also sagittal. So is flexion and extension of the elbow, so is flexion and extension of the wrist. And then there's one more plane that we haven't done, this movement here.
Horizontal.
This one, and also this one. So what plane is this?
Horizontal.
Horizontal plane, also called the
Transversal.
transverse plane, yes. So, and this is called horizontal adduction, horizontal abduction.
Okay.
Yeah, and through the neck, what movement is this? Vincent, look at my movement and try to envision like where the piston is, right? My head is moving, my head and neck are moving around a central axis. So what is that kind of movement called? When something moves around a pole. Like when you have an axle on a car and a wheel attached to it and the wheel's turning around the center, the axle goes to the center of the wheel and the wheel is turning. What is that called? The wheel does what? Rotates.
You said what?
Rotates.
Oh yeah.
So rotation is in the transverse or horizontal plane. Rotation also occurs where else?
Rotation also does your waist.
The waist, yes. And what bones make up the waist or can make up the waist?
I mean your hip. I'm sorry, your hip.
Can be the hip joint, like the femoroacetabular joint, can also be the spine. The spine.
Yes.
All right. And then what movement is this? Anyone? What movement is this? So the distal end is making a big circle and the proximal end is holding to a point. I don't know how to say that. I'm sorry.
I was about to say the distal proximal, but you already said it, so it can't be that.
No. This is called circum what? Circumduction.
Oh.
Circumduction. Okay. Yeah, you guys need to put more time in between classes learning these terms. Do the movements and learn the terms. Let's get it a little bit more solid so we can move on from this stuff. It's getting better. You are learning it for sure. It's just, you guys are much sharper than this, like you can learn it faster. My dog freaks out whenever things are a little bit different. And we have this tonight. I have a cord going across his mat, so of course he's upset about that.
He's like,
Oh,
don't
God,
talk
love you.
about me to people.
He's you should see his face. He's not happy. Okay, let me pause the recording. So we already went over the heart. I think it's a good idea to go over the heart and the valves again. Let's see. So if you want to follow along on my screen, you can, or you can open up the documents in the MBLEx drive. Physiology. All right. Okay, so if you open up the FSMTB, it's the red PDF, FSMTB e-study guide, anatomy and physiology. The first slide says anatomy and physiology. The content of the section is designed to assess the candidate's basic knowledge. And then the second slide starts the study points of the circulatory system. These are the actual items that we're responsible for that we need to make sure that we know. Max, take that away from him. And so we're starting with number 1, understand the various ways massage and body work might affect circulation. Did we talk about this already? I don't think we did, right?
No.
Excellent.
I don't believe we did.
Good. So, okay, so almost every massage technique causes systemic circulation. In terms of the body and massage's effect on the body, there's 2 locations and 2 terms that I want you to use. The first is local, which is the area where you're working, pressing, rubbing, using the hand technique. All right, that's the area where you're working, local. On the MBLEx, if they ask you, what's the effect on the triceps muscle? What's the effect on the circulation in the pelvis? What's the effect on the circulation in the thoracic region when you do technique XYZ? They're asking you about the local technique, the local effect. If they say, what effect does massage have on the body? They're asking about the systemic, that's the whole body. Even if they're not specifying the word, even if they're not saying systemic, still the way that they're phrasing it, they're asking about the whole body, body-wide, system-wide. Is that clear to if that's unclear to anybody, please let me know. So get rid of this film strip view. Let me know if this is not big enough, okay? So when we talk about the ways that massage or body work might affect circulation, we're talking for the most part about systemic circulation. The local circulation is almost always going to be ischemia at first and then hyperemia afterwards. So ischemia means to suppress blood. So ISC, ISC means to suppress, and emia means blood. So that's to suppress blood. So if you have your thumb or the heel of your hand or your elbow on somebody's upper trapezius muscle, is that suppressing the blood flow or is it opening the blood flow?
Suppressing.
That's right. That's right. And can you tell me why? I know you know why, but can you say why?
Because I think it's holding the blood flow.
That's
from
right. That's right.
circulating.
Yes, it's holding the blood flow from circulating. It's pressing down on the blood vessels. It's closing or constricting the blood vessels through using pressure, through the application of pressure onto the blood vessels, onto the muscle and blood vessels. So almost all techniques begin with the suppression of blood flow. And then when you let up, the blood vessels open and a large amount of blood floods in, more than is normal. So hyperemia is a large amount of blood flow. Almost all techniques begin with ischemia as what's called the mechanical effect. And the body responds, that's called the reflexive effect, with hyperemia. So all techniques, by the way, are divided into mechanical and reflexive. Mechanical is what the hand or what the technique does to the body, right? So the hand or the technique is causing the suppression of blood flow. And then reflexive is the body's response, how the body responds to the technique. So the body responds by creating a large amount of blood flow, or when the vessels open, there is a large flow. So if they ask you, how does massage affect circulation? Are they asking you locally or systemically?
Locally, yeah.
No, if they said, how does massage affect the neck? How does massage, like, how does effleurage affect the neck? How does petrissage affect the thorax? How does tapotement on the sacrum affect the sacrum or pelvis? That would be local, right? That would be local. But if they say, if they're not very specific, you know, talking about petrissage on the back, tapotement on the sacrum, if they're not specific like that, they mean systemically. So how does massage affect the circulation, rather than how does massage affect the circulation on the traps? How does massage affect the circulation on the pelvis? Right, they're talking systemically. All right, now if they say, how does tapotement over the lungs? How does tapotement, that's poorly phrased. How does tapotement over the posterior aspect of the rib cage? How does tapotement on the posterior aspect of the rib cage affect the circulation in the thorax? Are they asking you systemically or locally?
Locally.
Locally, that's right. If they say a patient comes in and has a cut on his or her rectus femoris muscle, which is one of the quadriceps. If they say the patient has a cut along the rectus femoris muscle, are they asking you about a local problem or a systemic problem?
It's a local.
Local.
Local. Is anybody confused about that?
Local.
Okay, if they say the patient has a cut on the rectus femoris and has a fever, is the fever local or is it systemic?
Systemic.
Systemic. See, you guys are sharp. Very good. Okay, class dismissed. So the next study point, the next study point is understand the different blood vessels such as arteries and capillaries and the function of these blood vessels. Yeah. So if you can remember this order of blood flow, this will almost guarantee, this will almost guarantee that you get this, that you get the order of blood flow right. And almost all the vessels, I think actually all the vessels that you need are in here. Okay, so if you can just remember artery on one end and then vein on the other end, you'll almost have it made. But if you could add a little bit to that, flesh it out a little bit, it'll be even better. So bigger than an artery is the aorta. And then smaller than the aorta are arteries. And smaller than arteries are arterioles, which are the smallest possible. And then capillaries. And capillaries, technically capillaries are both arterioles and venules, I believe, but they just call them capillaries, and that's fine. And then venules or venule, and then vein is bigger than a venule, and then the vena cava is the biggest vein of all. So let's say this together one at a time, or 3 times, one word at a time. So aorta,
Aorta,
artery,
artery,
arterial,
arterial,
capillary,
capillary,
venual,
venial,
vein,
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 vena cava.
vena cava.
vena cava.
Can you guys see artery in aorta? Can you guys see the root artery R in aorta? Aorta is kind of a variation of R. Can you guys see that?
Mhm.
Yes.
Yeah.
And can you see the origin of vein in vena cava?
Yes.
Great. Okay, so again, aorta,
Aorta,
artery,
artery,
arterial,
arterial,
capillary,
capillary,
venual,
venual,
venial,
vein,
vein,
vena cava.
vena
vena.
cava.
Okay, time to turn the lights down. You guys don't see my screen anymore, do you?
Yes, I think. But which screen?
Should be black now. Do you still see it, or you see black screen?
We
No, we
still
see
see
it.
it.
Oh, you still see it?
Mm-hmm.
Okay. So okay. So repeat after me. So aorta,
Aorta,
artery,
artery,
arterial,
arterial,
capillary.
capillary,
What comes next?
vein,
Vincent. Venual, capillary, and then venual. So one more time, capillary, and then Vincent.
veniola,
Venual, yeah, veniola is close enough. Venual, and then
Venual.
what's bigger than a venule?
a vein,
A vein, and the biggest vein of all, Dora?
Vena cava. Oh, the
Vena cava.
biggest?
Good.
Oh, okay.
Yep. Vena cava. Yeah. Okay, let's go in reverse order. Stephanie, you and me, let's take the whole thing. Ready?
Yeah.
All right. So we're going to go from vena cava to aorta. So vena cava is the biggest. What's smaller than the vena cava?
Vein.
The vein. And then smaller than a vein?
Venola.
Very close. Venule. Venule. You totally
Yeah.
would have picked that out of multiple choice. And smaller than a venule is,
Capillary.
yes, now the words change, capillary. And then they change again. Bigger than a capillary is, the equivalent of venual is arterial. Venual and arterial. Venual, capillary, arterial. Venual, capillary, arterial. So from venual to capillary, and from capillary to
Arterial.
arterial. Good. From arterial to bigger than arterial.
Artery.
Artery. And the biggest artery in the body is the
Aorta.
aorta. Okay. Dora, let's go from aorta all the way through vena cava. You ready?
Yes.
Okay. So biggest artery in the body is the aorta. And then smaller than the aorta is the
Artery.
artery. And then from artery, we go to
Are
just guess.
it's still AR, but I don't remember the rest.
That's right. Yes, it is. But you remember it's not artery. Yeah.
No, it's not artery because artery
And it's not. That's right. And it's not aorta, right?
Yeah, it's not aorta. So it's
yes. So you're still.
AR. I forget the name, but it's not either one of those other two. It's the.
That's right. So you could probably.
It's a longer word. I forget the name.
Yes, you probably could pick it out from multiple choice. So that's a test taking strategy. So arterial.
Arterial. Yes.
Arterial. Now the words change. From arterial, the blood goes into the what?
Capillaries.
Capillaries. Good. And from capillaries, the blood exchanges from arterioles into
Venules.
Venules. Very good. Nailed it. And from venules, we go into the larger vessel, which is
Veins.
veins, and then from the veins into the largest vein of the body, which is called the
Vena cava.
vena cava. That's correct. Very good. Very good. We covered the blood flow of the heart. Don't worry, Vincent. I will be spotlighting you tonight. In addition, let's see. Okay, you guys have to. You also have to know the function of the arteries and the veins. Arteries carry blood away from the heart. So letter A goes away from the heart. Letter A goes away from the heart. The heart is in the center of the body. The heart is the reference point. Okay. So letter A is away from the reference point, away from the center, away from the heart. Veins carry blood toward the heart. They carry blood back to the heart. So let's see if you guys can understand the oxygenation. Now there's two flows in the body, two circulations in the body. One is the pulmonary circulation and one is the body or systemic circulation. So pulmonary is between the lungs and the heart, and the systemic or body circulation is between the body and the heart, or the heart and the body, right? So so when the blood is pumping, when the heart is pumping blood out to the body, away from the heart, out to the body through the systemic circulation, does that blood have oxygen in it or carbon dioxide?
Oxygen.
That's right, oxygen. So, and it's going away. Is it going through the arteries or the veins?
The arteries.
Yeah, so in systemic circulation, what's the role of the arteries? To carry blood, and to carry what type of blood? Oxygenated or deoxygenated?
Oxygen.
Yeah. So yeah. So in the systemic circulation, the role of the arteries is to carry is what?
To bring oxygen everywhere.
To carry oxygenated blood
Yes.
away from the heart toward the body. Okay. If I asked you which circulation delivers oxygenated blood to the body, would that be pulmonary or systemic?
Pulmonary.
Oxygenated blood to the body.
Oh, systemic then.
Systemic. Does that make sense to you, Vincent?
Yes.
Arteries carry oxygenated blood from the heart out to the body. Okay, now the veins. Vincent,
Yes.
if arteries carry oxygenated blood from the heart to the body, to the tissues of the body, the head, the muscles, the brain, the organs, the legs, what would the role of the veins be?
It takes carbon dioxide through your whole
Yeah.
entire body.
Yes. Well, it doesn't take it through the body. It takes it from the body.
Yes.
And the word that they like to use is from the tissues. It takes it from the tissues and it brings the carbon dioxide or the deoxygenated blood where? Arteries go away. Arteries go away from the heart. Veins go what?
Towards the heart.
Towards the heart. So the role of the veins is to carry what kind of blood? Which direction?
Deoxygenized blood to the heart.
Correct. Deoxygenated blood to the heart. Okay, Dora.
Yes,
Dora.
I'm right here.
Once deoxygenated blood reaches the heart, logically, what does the body need to do with it?
Pump it.
Yes, but it's gotta. Okay, let me rephrase the question. Once the body tissues pull the oxygen out of the blood, and the blood picks up carbon dioxide from the tissues, what's the next logical step for the blood? Blood is carrying carbon dioxide And the body needs to do what with that?
To give you air or to give you, what is it?
Yes, you're very close. You're so close. The body needs to exhale the carbon dioxide.
Okay.
Needs to get rid of it. How does it get rid of it? It goes from the body tissues into the heart and then where? To the lungs.
From the body tissue. Oh, okay. To the lungs.
From the body tissues into the heart and then to the lungs. What's that circulation called from the heart to the lungs? Pulmonary or systemic?
Pulmonary. No,
Pulmonary,
systemic.
that's right. No,
I would
from the
imagine.
heart to the lungs.
Okay.
Go ahead, you would imagine what?
Nothing, because I was thinking the system. So it would be systemic because of the
Okay.
lungs. But yeah. It would,
Okay, fair enough, fair enough. But systemic means like body wide in this case, right? And pulmonary refers to the specific part of the body, the lungs, right? So one part of the body versus the whole body. Systemic's the whole body,
the
pulmonary is
whole
just the body.
system. Okay.
Yeah, so the whole system gives off carbon dioxide, the blood picks it up and brings it to the heart. Then through the pulmonary circulation takes it into the lung, and then the lung exhales it. The lung helps us allows us to exhale it.
Gotcha.
And the blood is then refreshed in the lungs, right? It gives off carbon dioxide and it picks up oxygen. So now the blood is oxygenated and it has to come back to the heart. And then once the oxygenated blood is into the heart, what do we do with it? What does the body do with it? Sends it back out into the tissues. And what's that circulation called where we go from the heart out to the rest of the body? Is that pulmonary or systemic?
Pulmonary.
Systemic.
Systemic. Okay, heart from the lungs is pulmonary. Repeat after me. From the heart to the lungs is pulmonary.
Heart to the lungs is pulmonary.
From the heart to the tissues is systemic.
Heart to the
To the
tissue.
lung, tissues is systemic.
Yeah, heart to the tissues is systemic. Heart to the tissues is systemic.
Heart
Heart
to
to
the
the tissue is systemic.
That's right. Lungs, pulmonary.
lungs,
Not
pulmonary.
pulmonary.
Body, systemic.
Body system.
It's systemic.
I have 3 of you in the class and I'm hearing 2 voices. Where's my 3rd voice? Is everybody here? Everybody's here.
Yes.
Is that Stephanie
Yes.
I'm hearing or Dora? Who am I missing?
I'm here. This is Dora.
You are here missing one? Okay, excellent. Thank you. So lungs is pulmonary.
Lungs are pulmonary.
Now I got 1. Let me get 3
I didn't
voices.
get a chance to say it yet.
All right. Lungs is pulmonary.
Lungs is
Lungs are
pulmonary.
pulmonary.
One more time, 3 voices. Lungs is pulmonary.
Lungs is
Lungs are
pulmonary.
pulmonary.
There we go. The body is systemic.
The
Body
body
is
is systemic.
That's right. Body is systemic. Lungs is pulmonary.
lungs is pulmonary. Body system.
Body is systemic, lung is pulmonary.
One last time. The body is systemic.
The
The
body
body
is
is
systemic.
systemic.
Lungs is
Lungs are
pulmonary.
pulmonary.
Lungs is pulmonary.
Lungs are pulmonary.
Okay. Stephanie, can you read this sentence right here?
Arteries carry blood away from the heart, and veins carry blood towards the heart.
Yes. Dora, can you read this sentence right here?
With the exception of pulmonary blood vessels, arteries carry oxygenated blood and veins carry deoxygenated blood.
Is that sentence clear to you?
Yes.
Okay. And then Vincent, last 2 sentences.
All right. Arteries have thick walls with muscle tissue, veins, and thinner walls using valves to keep the blood flowing.
That's right. So don't look at the sentence, Vincent. Which one has muscles? and thicker walls? Arteries or veins?
Arteries.
Arteries.
Who said veins?
Hmm?
Okay, whoever said veins, study up, study up.
I said
Okay,
arteries.
well, okay, good.
Then I said
All right,
arteries.
all right, all right, all right. One last time for the order of blood flow. Aorta,
Aorta,
Aorta.
artery,
arteries,
arterial,
Arterial.
capillary,
Capillary.
veins,
veins,
venule, capillary, venule,
Venule.
venule,
vein,
Vein.
vena cava.
vena
Vena
cava.
cava.
Vena cava, yeah. So if you want to look at the diagram, let's follow like the arteries, arterioles, and capillaries out to the hand, and then the veins from the hand back into the heart. Okay, so it would look like this. So it's aorta. So say this to yourself, right? Aorta, and then
Aorta.
artery, yeah, and then artery, and then arterial,
Arterial.
and then capillary,
Capillary.
and then venule,
Venule.
and then vein,
Vein.
and then vena cava.
Vena cava.
Yeah, and you can see here on the top, you have the superior vena cava, which drains blood or takes deoxygenated blood from the arms and the head. And then you have the inferior vena cava, which drains or takes blood from the legs and the pelvis, abdomen, and thorax. All right. Now, both veins and arteries are types of blood vessels. They're types of blood vessels. Veins are blood vessels located throughout your body that collect oxygen, pour blood, deoxygenated blood, and return it to your heart. Arteries are blood vessels that distribute oxygen-rich blood to your entire body. Arteries are blood vessels that distribute oxygen-rich blood to your entire body. All right, next. Our next learning objective. So we did understand the various ways massage and bodywork might affect circulation. We learned systemic and local, and we discussed ischemia and hyperemia, and we said that massage has a systemic effect of increasing circulation. Hyperemia and ischemia are local. Increasing circulation is systemic. We went over the different kinds of blood vessels and the functions of the blood vessels. And now we're going to look at the larger structures of the heart, which we've done before. We're going to look at the valves and the heart chambers, and then the blood vessels going into and out of the heart. And we're going to identify which ones are pulmonary and which ones are systemic. We're going to do this just for a few minutes, right? Comprehend what occurs in the various larger structures of the heart, such as the valves and the different heart chambers. So when you look at the heart, I like these two graphics here the most. This third one is useful to see the valves, in particular the tricuspid valve on the left, on the right, and the bicuspid valve, mitral valve on the left. Somebody let me know if I mix up my left and right oxygenated and deoxygenated. I'm going to really try not to do that tonight. So I took these two graphics and I put them in your basics, right? And this document is easier for you to zoom in than the slides document. So the flow of the blood, I'll read the order to you and you guys follow along visually through the drawing. All right. So the superior vena cava and the inferior vena cava, they bring deoxygenated blood from the superior upper part, the inferior lower part of the body into the right atrium. Remember, atrium, letter A is on top, and atrium is like a ceiling or a roof. Atrium is on top. Ventricle, letter V, like a valley, is below. Atrium on top. Ventricle on the bottom, atrium on top, ventricle on the bottom. Superior and inferior vena cava bring deoxygenated blood into the right atrium, the right side. The blood passes from the atrium, right atrium, into the right ventricle. It goes through the tricuspid valve, From the right atrium through the tricuspid valve into the right ventricle. The heart needs to get it out into the lungs to get rid of the carbon dioxide and to pick up oxygen. So it goes from the right ventricle into the pulmonary artery. Pulmonary means lungs, right? So it goes into the pulmonary artery. Arteries take blood away from the heart. Veins bring blood to the heart. From the right ventricle into the pulmonary artery, and it goes through the pulmonary valve into the pulmonary artery. The blood then goes from the pulmonary artery into the pulma, into the lungs. We exhale the carbon dioxide and we inhale the oxygen. We oxygenate the blood. It turns over in the alveoli of the lungs, and the pulmonary veins bring blood back into the heart. It arrives in the left atrium. From the pulmonary veins, oxygenated blood comes into the left atrium. The oxygenated blood goes from the left atrium into the right ventricle, and it passes through the bicuspid valve to do that. Then it goes from the left ventricle up into the aorta, and it passes through the aortic valve to do that. From the left ventricle into the aorta, aortic valve. And from the aorta, it goes into the upper and lower parts of the body. So if you can remember veins, right atrium, and arteries, left atrium, even if you remember nothing else, if you could just remember veins on the right and arteries on the left, you'll understand, you'll be able to deduce the rest, right? Because if veins carry deoxygenated blood, oxygen poor blood, and they bring it to the heart, then that blood must next go to the lungs. If there's no oxygen in the blood, it has to go to the lungs to pick it up. And then you can fill in the blanks, right? Letter A on top, letter V on bottom, atrium on top, ventricle on the bottom. And the valves we'll go over in a minute. And then I'm still trying to get you guys to see the big picture. And then from the ventricle, it goes through the artery, through an artery to the lungs. It has to get to the lungs, it's got to go through an artery away from the heart. The heart is a reference point away. And the name of the artery is pulmonary. It's named after the structure that it's going to, pulmonary artery. And then after the blood exchanges gases in the lungs, it comes back through the veins. The pulmonary veins, again, named for the structure that it relates to, that it's coming from. Pulmonary veins brings the fresh blood, the oxygenated blood, back into the left atrium. From the left atrium, it goes into the left ventricle, and then through the aorta out into the rest of the body. Through the aorta into the arteries, arterioles, capillaries, into the rest of the body. And then you can fill in the blanks with the valves. So between the right atrium and right ventricle, where there's deoxygenated blood, that is the tricuspid valve. Between the right ventricle and the pulmonary artery is the pulmonary valve. And then between the left oxygenated atrium and the left ventricle is the bicuspid or mitral valve. And between the left ventricle, don't think this is easy for me to remember and say correctly, it's not. From the left ventricle into the aorta is the aortic valve. All right, guys, we need to take a break, but how can I help you with this? Is this like, do you guys have a sense of anything, any place where you're unclear that I can go over with you again? Or do you feel like totally confused? Like you have no idea? Do you want to drill the names of the structures 3 more times before we break? Or are you ready to move on?
I just think we need to practice.
Okay. Do you guys want to practice? You guys want to practice right now?
Sure. I wrote it down and everything, so I'm learning as I go. I wrote it
Yes.
down earlier.
Yes. And just as a reminder, it's great for you to write things down. And this MBLEx March 2023 basics document is here as a reference for you, as well as the slides. So on the right side, the heart receives deoxygenated blood. On the left side, it receives oxygenated blood. On the right side, it receives, deoxygenated blood.
Deoxygenated blood.
On the left side, the heart receives oxygenated blood.
Right side, oxygenated blood.
Right side, deoxygenated blood.
Oh,
Yeah,
right side.
I do it too. Got it on video. Yes, right side deoxygenated, left side oxygenated.
Left side oxygenated, right side deoxygenated.
That's right. Which vessel brings blood to the heart? There's one that brings it to and one that brings it away from the heart, and the heart is the reference point. So which one brings it to the heart, the vein or the artery?
Artery.
The vein.
The vein, that's right. Artery takes blood away from the heart. So remember, the heart is the reference point, meaning you're looking at the heart as like ground zero, as the base. So the veins bring it to the heart. The artery is the one that has the mnemonic aspect of the letter A, taking it away.
Okay.
Artery away, vein to. So it's the superior inferior vena cava that bring it to the right atrium. Superior and inferior vena cava bring it to the right atrium. You guys go ahead and mute yourselves, but say this out loud, okay? Because we have like 6 structures to name, and there's, a gazillion syllables in each structure. But repeat these after me, okay? Superior inferior vena cava, right atrium through the tricuspid valve into the right ventricle. Right ventricle through the pulmonary valve. Right ventricle through the pulmonary valve into the pulmonary artery. Pulmonary artery to the lung. Lungs to the pulmonary veins. Veins bring blood to the heart. Pulmonary vein into the left atrium. Left atrium through the mitral valve, bicuspid valve. Through the mitral valve, bicuspid valve. Into the left ventricle. Left ventricle through the aortic valve. Into the aorta. Into the systemic circulation. We're going to do that one more time with the mute on, and then we're going to unmute. So you guys best be practicing. Superior inferior vena cava into the right atrium. Right atrium into the right ventricle through the tricuspid valve. Right ventricle into the pulmonary artery through the pulmonary valve. Pulmonary artery into the lungs. Lungs into the pulmonary vein. Pulmonary vein into the left atrium. Left atrium into the left ventricle through the mitral bicuspid valve. Through the mitral bicuspid valve. BMW. I just got that. Bicuspid mitral valve, BMW. From the left ventricle into the aorta through the aortic valve. Okay, unmute. And let's share with the world our beautiful cacophonous mess. Superior inferior vena cava into the right atrium.
Superior inferior vena valve into the right atrium.
It seriously, that's awesome, guys. It seriously was like almost perfectly in sync. Awesome. Okay, right atrium into the right ventricle through the tricuspid valve.
Right
Right
atrium
atrium
through
into the right ventricle into the right cuspid valve. Did I say
Okay.
it?
Almost, yes, almost perfect. But we're missing two of our friends. Right atrium into the right ventricle.
right
Right
atrium through
into
the
the
right
right
ventricle
Through the tricuspid valve.
through the
through the tricuspid valve.
There's Dora. Welcome back.
No,
Right
I've been
ventricle
here.
in. Well, I'm not hearing you. Did you say? Were
No,
you saying?
I've been saying it. I
Oh,
think
you
it
are?
was
Okay.
I think it's the
Okay. All right. Well, maybe. All right. Yeah. Well, I'm just trying to make sure everybody participates. I'm not picking on you. All right. So maybe I'm picking on you a little bit. All right. So from the right ventricle into the pulmonary artery.
Right ventricle into the pulmonary valve.
Good. Through the pulmonary valve into the pulmonary artery. But let's try mixing up the sentences a little bit to force your brain to work a little more. So right ventricle into the pulmonary artery through the pulmonary valve.
right
Oh,
ventricle.
right
into the-
ventricle to the pulmonary valve through the pulmonary artery.
Good enough. Good enough. Pulmonary artery into the lungs,
Pulmonary artery into the lungs.
and then lungs into the pulmonary veins.
Lungs into the pulmonary veins.
I'm only hearing one voice. Are Stephanie and Dora speaking?
I I had been speaking, but I don't know.
Okay.
Okay.
Okay. All right. Let's continue. So lungs into the pulmonary veins.
Lungs into the pulmonary veins. This is Dora.
Not, yeah, nice. Now all I hear is Dora. Okay, good. No problem. So pulmonary veins into the left ventricle. Atrium.
Pulmonary veins into the left atrium.
Yeah.
Yes. Left atrium into the left ventricle.
Left
Into the left
atrium into the
ventricle.
left ventricle.
Mhm. Through the BMW.
Through the
BMW.
BMW.
Bicuspid mitral valve.
Bicuspid ventricle.
Nice. Okay, left ventricle into the aorta through the aortic valve.
Left ventricle into the
Through the aorta, through the aorta valve.
Very good. Very good. Okay. That's 3 times around. I think you guys are ready for a break. What do you think? You ready for a break?
Sure.
Okay. All right. Take 10 minutes. So come back at 9:25 Eastern time, 9:25 Eastern time. Good work, guys. Huh, there it is. It was like, where's the rest of the information? All right. So guys, we're going to go over the rest of the circulatory system, and then we're going to switch to something else. So we just did what occurs in the various larger structures of the heart, like the valves and the different heart chambers, right? And then now we're going to identify the basic categories of the components of the blood and the functions of these components. One of our crew is having difficulty coming back in. So give me just a minute. No. All right. So blood is made up of 5 parts. Some would say 4, some would say 5. I like to think of blood as 5 parts because it accounts for plasma, red blood cells, white blood cells, platelets, which most people call the 4 components, as well as hemoglobin being the 5th component. So plasma is the majority of blood. You guys probably heard that the body is mostly water. Well, blood also is mostly water. Blood is 55% water, right? And then all the stuff in it, the red blood cells, white blood cells, platelets, the hemoglobin is inside red blood cells. So when you say red blood cells, it includes hemoglobin, right? So red and white blood cells and platelets, that's 45% of the blood. Plasma is mostly water, and it contains also nutrients and waste products. Nutrients can be proteins, can be ions, like sodium, chloride, potassium, and also has wastes mixed in like carbon dioxide. And of course, the blood would carry like pieces of other broken down structures, red blood cells that are broken down, dying or dead. And those will be carried to various places in the body and either captured, for example, bacteria and viruses that have been destroyed or will be destroyed are captured by the lymphatic system. And then the spleen captures decaying red blood cells. I don't think that they're going to ask you that. I just want you to have a like visual in your mind of where these things go, like what's in the blood and where these things go. The proteins and the ions, those nutrients that are in the blood, those are used to build structures. Part of the body's repair is building and part of it is breaking down. Together, those two processes make up metabolism. So breaking down, cleaning stuff up, the tendon that is frayed, the inflammation that has accumulated, the bone that has shattered, cleaning things out. That's breaking things down and cleaning them out, and then repairing the bone, repairing the fascia and the muscles, bringing healthy inflammation and fresh blood and nutrients to injuries. That's building things up, metabolism. Red blood cells, also called erythrocytes, those are the ones that carry oxygen. They also carry carbon dioxide. Erythrocytes contain hemoglobin, which is a protein. And hemoglobin is like a magnet for oxygen. It comes from iron, which makes it red, and it carries or binds to oxygen. So hemoglobin is a protein that makes blood red, comes from iron. Iron is red and carries oxygen. Red blood cells are called erythrocytes. Cyte means cell, erythro means red, so red cell. And then there are white blood cells. White blood cells are called leukocytes. Leuko meaning white, cyte meaning cell. White blood cells, since we're here, are part of the immune system. Their role is to mobilize the immune system, to act as part of the immune system, to function as part of the immune response. So leukocytes do a lot of different things. They do chemical signaling. I think they may actually ingest, like phagocytize some particles, some things, but don't quote me on that, and you don't have to know that. Again, I just want you to have a little bit more meat on the bone of your context. But as long as you remember that white blood cells or leukocytes are part of the immune system, they function in the immunity, in other words, then you're fine, you're golden. Platelets. Platelets are responsible for blood clotting. Platelets are like these non-cellular structures, so they're not living cells, but platelets actually, let's see if I can find a picture of a platelet in here. No, okay, so the role of platelets is to cause clotting, basically. That process is also called coagulation, or here we go, hemostasis. Why isn't this highlighting? Hemostasis. We'll get to clotting later when we talk about the blood's role in healing, which is one of your study objectives. So hemostasis. So when you hear platelet, I want you to think clotting or hemostasis. Platelets are responsible for clotting. When you hear red blood cells or erythrocytes, I want you to think oxygen. Oxygen. When you hear white blood cells, think immunity. And when you hear hemoglobin, also think oxygen and think red, oxygen and red. Plasma, think water, nutrients and wastes. Water, nutrients and waste. Okay, your next learning objective is to understand basic concepts of the exchange of oxygen and carbon dioxide within the circulatory system, including sites for this exchange. So there are two types of respiration. There's the external respiration and the internal respiration. So external respiration is everything from the lungs. So that includes these structures called the alveoli. And that is actually where the oxygen and carbon dioxide are exchanged. So if you look at this little structure down here, they look like grapes, which I think alveoli may actually mean grapes. But again, don't quote me on that, but there's no harm in thinking of them as grapes or bundles of grapes. So the alveoli are where oxygen is absorbed across the cell barrier or the barrier of the body into the blood. The blood binds to the oxygen, the hemoglobin in the red blood cells binds to the oxygen and carries it back into the heart through the what? Arteries or veins? Arteries away from the heart, veins towards the heart. So from the lungs to the heart would be what? Which one?
Veins.
Would be the veins. That's right. The pulmonary veins, and they come into which side of the heart, the left or the right side of the heart?
The right.
The left side of the heart, the left side of the heart. Right side is the inferior superior vena cava. Left side is the pulmonary vein. Okay, so the external respiration is the air coming in through the nose and mouth, through the trachea down into the lung, across the barrier of the alveoli into the blood. And it's carbon dioxide coming up to the barrier of the alveoli, diffusing or osmosing across that barrier into the air of the lungs and then being exhaled. That's external respiration. Remember that it includes the alveoli of the lungs, Internal respiration is the gas exchange between the blood and the tissues. So the internal respiration happens right inside of the body after the oxygen and carbon dioxide have gone across the barrier of the alveoli. So it's the outside into the lungs and the alveoli, and then after the alveoli, it's the blood into the rest of the body, including heart and all the rest of the tissues in the body. So gas exchange between the blood and the tissues. And the role primarily of internal respiration is to bring oxygen to the tissues and to pick up carbon dioxide, to take carbon dioxide from the tissues. The blood carries oxygen and drops it off at the tissues, and then picks up carbon dioxide and carries it from the tissues back to the lungs where it's exhaled. So if you look at this diagram over here, or this picture over here, the bigger one, no, it's very straightforward. It's blood circulation here, right? And then there's a white space here. So the white space should tell you that this is a space. And the space is between a blood vessel and a tissue. Could be lung tissue, could be muscle tissue, could be heart tissue, whatever, right? And you can see these dots, they're labeling them as carbon dioxide in one arrow, and oxygen in another arrow. And notice that the gas, the carbon dioxide, is going from the blood vessel into the tissue, and the oxygen is going from the tissue into the blood vessel. So if the oxygen is going from the tissue into the blood vessel, what organ is this? The lung or the muscle?
The lung.
Lung.
The lung, that's right, the lung. And carbon dioxide is being osmosed or diffused into the lung, and then it's being exhaled from there. External respiration brings oxygen into the lungs, absorbs it into the blood, and internal respiration takes oxygen from the blood to the tissues and takes carbon dioxide from the tissues to the lung. Is that unclear to anybody? Does anybody need me to discuss that further or clarify anything?
No.
No. No.
Then, okay, then two more slides. So yeah, external respiration lungs, internal respiration tissues. Okay, and then the last learning objective for the circulatory system that we're going to go over tonight is understanding the blood's role in healing. So they weren't overly specific in this. Right here it is right here. Understand the blood's role in healing. I wish they had been more specific. But oh wait, they are more specific down here. Understand the functions of the basics of blood cells, such as erythrocytes, leukocytes, lymphocytes, thrombocytes. Okay, I don't have lymphocytes, so I'll have to get those for you. But some of the functions are listed here, right? And those are platelets, red blood cells. Okay, yeah, you can read those. So I will discuss the functions. So we mentioned earlier that platelets are the ones that create blood clotting. So here it says platelets first. What platelets first? What I mean by that is that when there is a cut or an infection or a sprain or a muscle tear or a fracture, in order for healing to begin, the component that has to act first are the platelets. The first thing that has to happen is the platelets have to slow down the movement of the blood. They have to clot the blood. They have to coagulate the blood. They cause hemostasis. And that is to either stop bleeding or to stop excessive amounts of blood going outside of the vessels or the tissues into the spaces between the tissues, which is a form of swelling, and to prevent blood loss. And that also, platelets also create inflammation. They also create inflammation. And inflammation is a process that initiates the rest of healing. So inflammation is important because it's not just, like water or histamine factors or stuff that's like hot and swollen. It's actual blood. And to bring blood to the area means to bring nutrients and repair molecules, repair cells to the area. But you can imagine if you had like a muscle tear or a fracture or a cut, if the platelets didn't clot the blood, if it didn't coagulate and stop the movement of blood in the area first, and the body created inflammation, which increased the blood flow to the area, you would have a whole lot of bleeding or a whole lot more swelling than would be healthy, right? So the platelets first have to clot the blood, slow down, stop the bleeding, and then behind that clot, there's fresh blood coming in, inflammation. And that in order for the inflammation to happen, the blood vessels have to dilate in order to bring in more blood. The blood vessels have to open. So that's part of the healing response. Part of the circulatory system's response is to dilate the blood vessels. And then for the red blood cells or the erythrocytes, oxygen comes in through those. And then the erythrocytes also bind to carbon dioxide waste and carry that away from the site of injury. Red blood cells also function to reduce inflammation later on when the body has had enough inflammation or when it's ready to start reducing swelling and reducing inflammation in the second stage of healing, I guess, in the later stages of healing after the acute stage. The body's ready to reduce inflammation, and the red blood cells, it's their job to do that. They bring in oxygen, they remove carbon dioxide, and they reduce inflammation. Platelets increase inflammation, red blood cells reduce inflammation. It's the job of plasma to function as like the transportation vehicle. So it moves all the platelets, all the red blood cells, all that stuff has to be in water, in the stream, in the river, in order to flow, in order to get to the site for healing. Plasma, obviously, it also transports other things like nutrients, white blood cells, clotting factors, wastes. And then white blood cells, their role primarily is to protect the area from infection, to become active there and to stop any infection, or to clean up, destroy any microbes, viruses, bacteria that might be there, and to check all of that. Hemoglobin is the protein that is in blood and carries oxygen. So that's hemoglobin's role, is to actually carry the oxygen that's in the red blood cells. Okay, and that's it for the circulatory system for tonight. Do you have any questions about the blood's role in healing? Okay. So let me show you guys where you're at. So here's the work that you need to do on your own. So this slide has all the study points on it. We went through, I think 1, 2, 3, 4, 5, and part of 6 study points. So for the cardiovascular system, we're not going to come back to it the rest of our class. So you have to do the other 4 study points on your own. That's understanding the functions, the basics of the blood cells, such as erythrocytes, which we covered, leukocytes, which we covered, lymphocytes we didn't cover, thrombocytes I don't think we covered. Identify the major, wait a minute. Are thrombocytes platelets? I think they might be. Yeah, another term for platelet. Thrombocytes are platelets. So we covered the platelets. We didn't cover lymphocytes. You guys have to go look up lymphocytes on your own. Just go to Google and put in function of lymphocytes or role of lymphocytes. You have to identify the major pulse points on the body. That's the carotid artery at the neck, the radial artery at the wrist, maybe the abdominal artery in the abdomen, and then the artery of dorsalis pedis. That's the dorsum of the foot, dorsalis pedis. They may also ask you about the artery in the inguinal artery, but you just have to know where those are. You should know where those are, the names of them and location. Identify the major blood vessels, such as the carotid artery, femoral artery, and others of that magnitude. Understand the blood's role of transport within the body. What's the blood's role of transport? It's to transport nutrients, waste. The blood transports red blood cells, white blood cells, platelets. It transports hemoglobin. It transports oxygen. It helps to heal the body, which is a process that involves clotting or coagulation or hemostasis, creation of inflammation, reduction of inflammation, and then repair of tissues, and also an immune response. Understand blood pressure, including the basic factors that contribute to it. So how does dehydration or hydration, how do those contribute to blood pressure? About blood pressure. I think that's probably enough for blood pressure. Yeah. And also understand how the constriction of arteries or the constriction of blood vessels versus the dilation of blood vessels affects blood pressure. The more constricted the blood vessels are, the higher the blood pressure, because they're squeezing against the blood and the blood is pressing against the vessels. And the more dilated they are, the lower the blood pressure, because the more space there is, for lack of a better term, between the blood vessel and the blood. And what does massage do to the circulation? What does massage do to the circulation systemically? Does it increase it or decrease it?
Decrease it.
Okay. It decreases the blood pressure.
Yes.
But to the circulation itself, it increases the circulation.
Oh, okay.
Yes. Okay, so let's take a look now at, and this is available in body systems. So you go to the MBLEx folder click on body systems, and it's cardiovascular circulatory. It's that one. All right, before we conclude, let's look at, let's just do some discussion on pathology, contraindications, areas of caution, and special populations. Let's find something, begin it, and we'll go more in depth next time. Okay, so here's one that, so these are your study points. This is under the category of contraindications. So we started this concept already. Understand the difference between local and systemic contraindications. So local is a smaller area, like the area where you're looking, the area where there is an injury or an infection, or where healing needs to be, and the systemic is the whole body, body-wide, right? So contraindications locally, when what they're asking you about is whether massage is contraindicated, right? So tell me some things that you might see locally on the skin that would say to you, don't massage here, don't put oil here, don't even touch.
Athlete's feet.
Athlete's feet. Okay, so like fungal overgrowth.
Yeah, that's a local
All right.
indication. Skip the feet.
Yes, yes, and you may see fungal overgrowth in other places too, like you might see it along the scalp, or you may see it in the ears, or you may even see it on the skin in other places. What else?
I got a
How
question.
about where
Does
the
shingles count as local or Semitic?
very good question. Very good question. Well, what do you think?
I want to say it's local because you'll see it in one
Yes.
area, but it could also be
Yes.
everywhere else. So not sure.
Yeah. Yeah. Well, I mean, it's, you know, when you have something like shingles, there are systemic effects, like an increase in immune activity. Sometimes there can be fatigue. You could say that the whole body is a little bit more inflamed because that's what happens with the body when it's fighting off some kind of when it has an immune response of that level, right? Whether it's like shingles locally, or whether it's whether it's shingles, or whether it's food allergy, or seasonal allergies, the whole body becomes more inflamed, right?
Yes.
But that definitely would be something that would be a local contraindication. So an active case of shingles where there are lesions on the skin that are red and irritated, painful, you definitely do not want to massage locally. Like, let's say I had shingles once, and it was right along the like the C7 T1 dermatome. T1, yeah, more like T1 dermatome than C7, and it was right along the supraspinatus muscle, along the infraspinatus, down the tricep, like that. And you could say that this area, the tricep, the infraspinatus, the supraspinatus, that's a local area where you have to stay away from, right? But there could be other areas where you might be able to work. You would be able to work the paraspinal muscles on the back. I wouldn't do a lot of like petrissage or deep cross fiber friction, that kind of thing. I would do flushing techniques to relax and soothe and calm the nervous system. And that hopefully would help the immune system work a little bit better, and also would just be very comforting to the person. Don't underestimate the effect of comfort on the neurological and the endocrine system, and the effect that has systemically is very important. We use acupuncture needles for that kind of thing all the time. The strategy is exactly the same as putting a hot stone on somebody, or using like gliding techniques, right? Or using aromatherapy. Okay, so anyway, so yeah, shingles would definitely be a local contraindication. Don't work here locally. The shoulder area would be, in my case where I had the shingles, would be local, right? And then systemic contraindications. Oh yeah, give me one more local contraindication. How about something where the skin is open?
Oh, any type of cut. Okay.
Any type of cut, yeah, or an abrasion, you know, road rash, something like that. Okay, how about oh, sunburn, where they're peeling, definitely a local contraindication. How about systemic contraindications? What are some things that happen throughout the whole body that would say, don't work on this body? In these cases, you shouldn't be working on this person at all.
Fever.
What are something? Fever, exactly, fever. Yeah, what else?
If they're on antibiotics.
Well, I don't think antibiotics would be a systemic contraindication, but if they are immune compromised, if they have a particularly weak immune system, you know, they're like, let's say that they're a cancer patient, or they, what are some other things? What are other things that cause weakened immune systems? Syndromes with weak immune systems. Oh, pregnancy, type 1 diabetes, lupus. So, you know, diabetes, pregnancy, lupus, sometimes HIV. Those things definitely, cancer, those types of patients would definitely have compromised immunity, weak immunity, slow immunity. So yeah, if they're taking antibiotics for an infection, then at that time it might not be a good idea to be working on them, or even to have them in the facility. They're not going to ask you, should you even have them on the schedule? Should you even have them there? They'll just ask you if it's a systemic contraindication or not. Let's see. How about identify when certain types of treatment are contraindicated? We'll come back to that. Recognize the nature of contraindications, including fever, acute infectious disease, and inflammation. Understand the need to refer a client to a healthcare professional. Yeah, so if somebody has a fever, or if you suspect that they have an infection, especially if they have an undiagnosed infection, if they haven't seen a doctor, or if they have a history of compromised immunity, like a cancer patient who comes in with a new cut that's swollen and red, or anyone who comes in with a cut that is swollen and hot and red, they need to see a doctor like right away. I saw two MRSA infections that, well, one MRSA and one staph infection. MRSA is a type of staph. But people will come in saying, I have knee pain. I don't, you know, it's getting worse. I don't know what the problem is. And if the knee is swollen, yeah, that could be an injury. But if it's red and swollen and warm, and it's getting progressively worse, like not getting better, the body's supposed to be making it better. That means an infection is proliferating and the infection is making it worse. Okay. Specific issues like bad bruise, fracture, rheumatoid arthritis, open lesion, acute trauma, peripheral neuropathy. We'll talk about those in more detail. Let's see. Ways to adjust treatment based on skin pathologies. Yeah, that's going to be interesting. Common musculoskeletal conditions and disorders, sprains, strains, and trigger points. Oh, this is it. Wait, this, yeah, that'll be simple to go over. Okay, various types of pain: acute, chronic, visceral, and somatic. This is really useful. So the word visceral means viscera, which means organs. Visceral means organs. Visceral means organs. Somatic means the body. And when I first heard that years ago, I was like, what is it? Was it? That doesn't make any sense. The organs are part of the body. Yes, that is true. But in this context, somatic means muscles, tendons, bones, ligaments, blood vessels, lymph vessels. It doesn't mean the pancreas, the stomach, the spleen, the liver, the ovaries, the uterus. Those are organs. Those are part of the visceral part of the body. The soma is the body, the flesh and bones. The viscera is the body system, the 11 body systems. So there are different kinds of pain, right? So visceral pain might look like pain around the abdomen, around the colon area. So like the descending colon, the transverse colon, the ascending colon, right? Maybe someone has constipation. If you've ever had constipation or known someone who has, you know that there's a feeling of pain, bloating, distension in the belly around the umbilicus, wide around the umbilicus, around the belly button, because that's where the colon is. Maybe someone has a hernia or something happening with their stomach, right? So they may have a hiatal hernia around the area of the stomach. They may have an ulcer. The pain in that area is visceral type pain. Somatic pain in the same area of the stomach or in the same area of a constipated, clogged colon might look like a torn rectus abdominis muscle, which is something that runners get sometimes. It's infrequent, but they do get it. Torn rectus abdominis muscle might be a fracture of a rib. Torn intercostal muscle that are between the ribs, might be a bone bruise on the ribs. That's somatic pain. Stomach pain, intestinal pain, that's visceral pain. And there are some kinds of visceral pain that can look like somatic pain, but basically almost all the viscera, there's like one or two kinds of visceral pain that refer pain to other areas, and it can look like visceral pain, like the gallbladder. I think the gallbladder refers pain up to like the tip of the left shoulder. It's very strange, right? The heart refers pain down into the left arm. So that can look like somatic pain. It's actually visceral pain. But we'll go over these for greater clarity next time. Okay, guys, please send me a text message if you need clarification on anything, if you have questions about anything, or if you have feedback about stuff. All right.
All right.
Have a great night, guys. Good work
Thank
hanging
you.
in there. I'll see you in 2 days. You're welcome.
Bye.
Bye.
All right. Bye-bye.